Good morning. I'm Dr. Ken Latimer from the University of Georgia College of Veterinary Medicine. The subject of my lecture today will be selected viral diseases of companion and exotic birds. So at this time we'll go to the first slide. The initial part of this lecture will cover an overview of circovirus and avian polyomavirus infections. Birds are very popular companion animals. They also are prevalent in zoological collections, and as this cover of the National Geographic magazine illustrates, birds are colorful, they have human-like personalities, they can converse with people, so there's a very strong human-animal bond. There are approximately 30 to 50 million companion birds in the United States alone. One of the major viral diseases of pet birds is that of circovirus infection. The Circoviridae family includes chicken anemia virus, porcine circovirus, and Psittacine beak and feather disease virus as the three animal members of the viral family. In addition to that, plant viruses also fall within this category. Examples include banana bunchy top virus and coconut foliar decay virus, as well as subterranean clover stunt virus. So these were the major viruses within this family, at least during 1995, with the sixth report of the International Committee for Taxonomy of Viruses. I'll give you a little brief information about some of the circoviruses. Porcine circovirus was originally discovered in 1974 by Tischer in Germany as a contaminant of porcine kidney 15 cell line. In his original observations that were based primarily on morphologic characteristics of the virus, this was a very small virus, one of the smallest viruses that had been determined or had been viewed at that time. And Tischer thought that it was a picorna-like virus, again a contaminant in a porcine cell line. 8 years later, in 1982, Tischer had determined that this virus was not an RNA virus, but a DNA virus. The genome was single-stranded circular DNA, so this set the prototype for the Circoviridae family. More recently, porcine circovirus has been designated as porcine circovirus 1 and 2. Porcine circovirus 1 has serum antibodies that can be demonstrated in diverse locations and probably enjoys worldwide distribution. Porcine circovirus can infect both porcine and bovine mononuclear cells, but does not infect either ovine or human mononuclear cells. Serum antibodies to this virus have been reported in sera from humans, cattle, and mice, but these studies have not been fully corroborated. The virus is spread by horizontal transmission, although vertical transmission also may exist. Although this virus has been largely considered to be non-pathogenic, it may be associated with congenital tremor in piglets. Also, in an experimental study following infection of notobiotic pigs, non-suppurative myocarditis was observed 21 days post-inoculation. Porcine circovirus 2 has a large host range. It was originally described in Canada, the United States, and Europe. More recently, it has been described in Taiwan and Korea, and probably enjoys worldwide distribution like porcine circovirus 1. To date, there is little data on seroprevalence of viral infection, the host range, or details of mode of transmission. Most affected piglets are between 5 and 12 weeks of age and suffer from interstitial pneumonia, lymphadenopathy, pallor, jaundice, diarrhea, and ill thrift. Ill thrift is most apparent immediately after weaning, and thus the term post-weaning multisystemic wasting syndrome has been applied to this condition. Porcine circovirus 2 also is involved in reproductive disorders, including abortion in sows and fetal lesions. And occasionally the presentation of porcine circovirus 2 infection gives a PRRS-like appearance, or porcine reproductive and respiratory syndrome-like appearance. Little is known about the control of porcine circovirus, and vaccines currently are unavailable. The best that can be done commercially is diagnosis and removal of affected animals combined with good husbandry. Circoviruses as a whole are resistant to inactivation by many disinfectants and detergents. More recently, since 1997, circoviruses have also been described in sera from human patients. The original virus that was described was designated TT virus, and this was discovered in 1997 in the serum of a Japanese patient with post-transfusion hepatitis. The name of the virus, the two letters TT, are taken from the initials of the index patient. This virus is non-enveloped, 30 to 50 nanometers in diameter, with an icosahedral capsid. The DNA genome is approximately 3,800 bases in length, single-stranded, circular, negative sense DNA. PCR fragment sequence heterogeneity indicates that there are approximately 5 closely related but different viral strains of TT virus. Double-stranded TT virus, or virus present as minus and plus strands, have been recovered from human liver and bone marrow cells, indicating that this virus replicates at least in these two cell types. TT virus is common in the blood of U.S. Blood donors with an infectivity rate of approximately 38%. Of these 38%, approximately 84% have had viremia at the time of blood donation. TT virus also has a high frequency of postnatal transmission of virus in studies performed in Japan. There is cross-infection of TT virus with primates, and the researchers originally proposed the family name Circoviridae for this virus. It is one of the larger circoviruses. In 1999, another human circovirus was described and has been designated TT-like mini-virus. This virus is larger than chicken anemia virus, but it is smaller than the more recently described TT virus. TT virus-like mini-virus has a mean diameter of less than 30 nanometers, and the DNA genome is approximately 2,900 bases in length. It is single-stranded and circular. Therefore, it's shorter than the genome of TT virus, but longer than that of chicken infectious anemia virus. The mini-virus has been found also in the sera of transfusion donors, and the researchers that discovered this virus have proposed the family name Circoviridae for TT-like virus and TT-like mini-virus. Their reasoning behind this is that the proposed name Circoviridae for these members is too confusingly similar to Circoviridae. Returning now to the avian circoviruses, the first one that I'll talk about is chicken anemia virus. Chicken anemia virus is a member of this small pathogenic DNA virus group. Most of the viruses will range in size from 14 to 24 nanometers in diameter, and they have geometric symmetry to their capsid, which is non-enveloped. Although all of these viruses in the family possess single-stranded circular DNA, chicken anemia virus has the largest genome, approximately 2,300 bases in length. This is an example of a typical isolate of circovirus. The virions have an icosahedral capsid, and they're very small. Also present is tobacco mosaic virus as an internal standard. These are silver-spangled Hamburgs to get us interested now in chicken anemia virus. Chicken anemia virus is known by a host of names. Originally, it was a filtrable agent that was infectious. It was smaller than bacteria and was referred to as chicken anemia agent, or CAA. Once the viral etiology was shown by UASA in 1979, there was a move to call this agent chicken infectious anemia virus or chicken anemia virus. And in light of current known information, probably even a better name at this point in time would be chicken circovirus. Chicken anemia virus is ubiquitous in distribution, and it has a larger diameter to the virion, up to 24 nanometers in diameter. Of the avian circoviruses, again, it has the largest DNA genome, which is 2,300 bases in length, and the replication is intranuclear. Chicken anemia virus is spread by both horizontal and vertical transmission, and viral inclusions have been seen in day-old hatchling chicks. Although this virus will infect birds of any age, disease is especially severe in 2 to 3 week old chicks because of destruction of the immune system and a plethora of secondary infections. Clinical signs of circovirus infection usually are apparent within a week and a half to 2 weeks following inoculation, experimental inoculation of birds, or up to 28 days following exposure to the virus in the field. The mortality is generally less than 30%. One of the problems in spread of the chicken anemia virus in production operations is that the litter is not changed in the houses between each rearing of successive batches of chickens. They'll just overlay new litter, so eventually the chicks will be exposed to the virus as they move the litter around. Clinical signs of chicken anemia virus infection include depression, weight gain, decreased weight gain, pallor of comb, wattles, and shanks, and development of secondary bacterial, viral, and protozoal infections. Notice that depression and weight gain are very nonspecific signs of clinical disease that are seen in most birds with circovirus infection. As far as lesions in histopathology of chicken anemia virus, the major lesions are thymic and bursal atrophy with discrete cellular necrosis, and also hypoplastic bone marrow, also associated with discrete cellular necrosis. Because of a lack of thrombocytes, multiple hemorrhages can be observed in a multitude of tissues. Destruction of bone marrow results in aplastic anemia, which will predispose the animal to secondary infection because of lack of heterophils. Also, generalized lymphoid depletion cripples both the humoral and cell-mediated immune responses. Secondary infections can be numerous and quite striking, and chickens that are affected with CAV will present like human AIDS patients. The ability to see viral inclusions is transient, usually apparent during the first 5 to 7 days of viral infection. Generally, inclusions are not readily available in routine tissue sections. There are several ways to diagnose chicken anemia virus. This includes traditional virus isolation in cell culture, and the virus, it can be propagated in MDCC MSB cell lines, which are derived from a chicken lymphoid tumor. Virus neutralizing antibody titers can also document viral exposure or infection. In addition, histopathology coupled with fluorescent antibody staining, immunohistochemistry, or DNA probing will also demonstrate viral infection. There is no effective treatment for chicken anemia virus. Most of the control has been based on biosecurity of chicken rearing facilities, and also biosecurity and careful selection of genetic stock from the major companies that produce chicks for grow-out operations. Vaccination is available in some countries and can be effective. Now we will delve into circovirus in companion and exotic birds. And on the left is the appearance of a normal sulfur-crested cockatoo. On the right is a cockatoo with severe chronic beak and feather disease, a citron-crusted cockatoo. Psittacine beak and feather disease has been championed as an emerging disease of importance in psittacine birds. But if you study the literature critically, the earliest descriptions of psittacine beak and feather disease were made in 1887 in Australia, where red rump parrots that were virtually featherless were observed to run along the ground. Most of these birds probably ended up being a meal ticket for various predators. In the 1970s, Drs. Poss and Perry in Australia did some of the elegant descriptions of clinical disease in affected cockatoos and also some of the best and earliest histologic studies. They described intranuclear and cytoplasmic inclusion bodies suggestive of viral disease, affected cell types including feather epithelium and macrophages, and also had some preliminary electron microscopic observations demonstrating virions in paracrystalline arrays. In 1989, the virus was recovered from tissues of diseased birds and characterized by Dr. Ritchie and his research group at the University of Georgia College of Veterinary Medicine. It was at this time that psittacine beak and feather disease was shown to be a DNA virus with a single-stranded circular DNA genome, and work of Frank Niagro and Bran Ritchie placed this as the newest member of the Circoviridae family, along with chicken anemia virus and porcine circovirus. By 1992, commercial molecular tests were available to diagnose beak and feather disease, and the basis of these tests was the time-honored polymerase chain reaction. By 1992, experimental vaccine trials had been done at the University of Georgia using an inactivated Psittacine circovirus vaccine, but some vaccine breaks were experienced because the virus is small, environmentally stable, and very difficult to inactivate. As a matter of fact, the usual concentrations of beta-propiolactone used to inactivate viruses for killed vaccines are ineffective in inactivating circovirus. So for that reason, the inactivated viral vaccine should be considered too dangerous for clinical use. More recently, an inactivated vaccine was tried once more in Australia, but again was withdrawn from use because of adverse effects. PBFD virus is 14 to 16 nanometers in diameter. Like the other circoviruses, it possesses an icosahedral non-enveloped nuclear capsid. The single-stranded circular DNA genome is small, roughly 1900 bases in length. And as I have previously mentioned, this small virus is resistant to many disinfectants that are commonly used or inactivators of other viruses. This is an example of recovered circovirus from the skin and feathers of a diseased cockatoo. The virus load can be tremendous. This is an electron micrograph of an inclusion of beak and feather disease virus from a macrophage. And these cytoplasmic inclusions can have distinct paracrystalline arrays that are apparent in sheets, in semicircles, or circular configurations. Psittacine beak and feather disease virus is spread horizontally, primarily by viral contaminated feather dander. And dander can be obtained from air filtration systems, and the virus can be shown within that detritus. Also, the virus can be spread by contaminated excrement or crop secretions. Contaminated feces, when it dries, may become aerosolized and a source of infection. Psittacine birds usually feed their young by crop regurgitation, and these secretions can also transmit virus to neonates. Vertical transmission is also possible because viral inclusions have been seen in germinal epithelium. They've been seen both in sections of ovary and testis. The incubation period for beak and feather disease is generally 3 to 4.5 weeks. This disease in Psittacine birds usually presents with abnormal dystrophic or necrotic feathers. The type of feather lesions and distribution vary both with the age of the bird when it is first infected and the time of molt. Generally, once feather lesions are observed, they will progress with successive molts. In the most severe chronic disease presentations, delamination of the beak and claws can be observed. In the beak, the hard horny layer Rhamphotheca will separate from the other beak tissues. Sloughing of the claws can also be a major problem. And Psittacine beak and feather disease can present as a peracute, acute, or chronic disease syndrome. These are young African gray parrots with Psittacine beak and feather disease, and you can see loss of contour feathers and some loss of tail feathers and primary flight feathers. Notice the bare portion of the distal portion of the wing is apparent from primary flight feather loss. This is an Amazon parrot that died of Psittacine beak and feather disease, and although there is still some retention of primary flight and tail feathers, the majority of the contour feathers have been lost. Every research effort needs a poster child, and this was ours for the study of Psittacine beak and feather disease. This has been a cockatoo that developed the disease at about 18 to 20 years of age. And notice the marked loss of both contour feathers and primary flight feathers in this bird. A close-up view of affected feathered skin will show that the feathers are occasionally deformed. There is evidence of necrosis and hemorrhage within the feather shaft. Many of these feathers will also be contained in a thick feather sheath that is not lost in a normal manner. Plucked feathers will also show annular constrictions and other deformities. This gross photograph indicates some of the necrosis and hemorrhage within the shafts of the primary flight feathers. And depending on the age of the bird when it is infected, I have seen these individuals lose all of their primary flight feathers within a 24-hour period. Peracute PBFD infection is characterized by rapid secondary septicemia, bacterial pneumonia, enteritis, rapid weight loss, and these neonates usually will die very, very rapidly after clinical signs of disease occur. In acute disease, abnormal feathering may be observed. This is the first time that the feathers will look deformed or fail to develop properly. The acute disease is also associated with relatively nonspecific signs of depression, diarrhea, and crop stasis. Many acutely infected chicks will die within 4 weeks of age. The chronic manifestations of Psittacine beak and feather disease are associated with progressive symmetric feather dystrophy and loss. And as I've mentioned earlier, the feather loss becomes more apparent with ensuing molts. Now I might add that although beak and feather disease is expressed as 3 disease syndromes, peracute, acute, and chronic, many birds are exposed to beak and feather disease but fail to develop any of these disease syndromes. These birds will show evidence of seroconversion, but they'll remain clinically healthy. Histologic changes in beak and feather disease are usually characterized by the appearance of basophilic inclusion bodies. These inclusions are generally nuclear in epithelial cells and cytoplasmic in macrophages. Within macrophages, the cytoplasmic inclusions will be multiple and basophilic. To definitely show that PBFD virus is involved in a diseased individual. Either DNA probing or immunohistochemistry are the tools of choice to show specific viral infection. Secondary infections are common, diverse, widespread, and very severe in these diseased birds. This is a photomicrograph of feather pulp cavity and feather epithelium. And looking at this photomicrograph, you'll notice that some nuclei contain nice basophilic intranuclear inclusions. Other macrophages will contain multiple basophilic inclusions within the cytoplasm. And these macrophages can be seen not only in the pulp cavity, but also in the basal layer of the feather epithelium. With immunohistochemistry, viral antigen can be shown both within the macrophages containing phagocytosed debris as well as within the nuclei of basal feather epithelial cells. This is a section of bone marrow, and bone marrow in birds differs from that of mammals. In avian bone marrow, the granulocytes are produced in extrasinusoidal parenchyma, whereas the erythrocytes and thrombocytes are produced in the vascular sinuses. Note that the macrophages have viral antigen in them on immunohistochemistry and basophilic inclusions on routine hematoxylin and eosin stained tissue sections. A section of avian thymus, although viral inclusions are not readily apparent in the H&E tissue section on the left side of the screen, with immunohistochemical staining, the presence of PBFD virus is readily demonstrated. This is a section of bursa. These are the bursal epithelial cells. The follicle is largely depleted of lymphocytes. With viral infection and lymphocellular necrosis, macrophages will phagocytize that debris and have the characteristic multiple basophilic cytoplasmic inclusions. Again, with immunohistochemistry, we can show the presence of massive quantities of virus in these inclusions, but some of the inclusion consists of genomic or native DNA, not viral DNA. More recently, my laboratory has been using DNA in situ hybridization. For you Latin scholars, in situ is correct. For the rest of you, in situ will do nicely as well on terminology. On the feather at the left, the feather epithelium shows minimal change, perhaps a macrophage there, not many intranuclear viral inclusions. On the right-hand side is DNA in situ hybridization, and the chromogen is formazan. So the indicator here is an anti-digoxygenin antibody linked, the indicator here is a DNA probe with digoxygenin molecule in it that is detected by affinity cytochemistry. And the affinity cytochemistry uses an anti-digoxygenin antibody coupled to alkaline phosphatase. The chromogen is oxidized NBT, which is light yellow in solution, and once it is reduced by the alkaline phosphatase, it's deposited as dense blue-black formazan. The counter stain is fast green, so all the blue-black coloration indicates the presence of viral nucleic acid. This is a closer photomicrograph of feather epithelium following DNA in situ hybridization. Notice the presence of nucleic acid in the nuclear inclusions as well as within the cytoplasm of macrophages. Of interest, the blue-black color of the formazan is clearly distinguishable from melanin granules. This is a section of bursa. On the left-hand side of the screen are the typical multiple basophilic inclusions within macrophages. On the right-hand side, DNA in situ hybridization with a beak and feather disease viral specific oligonucleotide probe. As I mentioned, secondary infections are quite common. This is intestinal epithelium. Notice the microvillus border is not that apparent, and numerous basophilic circular structures of Cryptosporidia are on the surface, and heterophyls are present. Cryptosporidial infection in affected birds can be very intense, severe, and widespread. In the intestinal tract, it can infect the entire length of the tract from the proventriculus to the bursa. And notice that the Cryptosporidia are densely packed. You can see some evidence of sporulation, and a higher magnification showing the embedded Cryptosporidia. Protozoal infections can be of many different types. This is a scanning EM of Giardia. In addition to the protozoal infections, severe aspergillosis and mycobacteriosis also may be observed. Psittacine beak and feather disease may be diagnosed by molecular techniques. DNA probe blood test is the recommended procedure. If blood is unavailable, the disease may be diagnosed histologically, and specific beak and feather disease virus can be demonstrated using DNA probes or immunohistochemistry. Hemagglutination is unreliable clinically because the virus may or may not agglutinate avian erythrocytes. It's a very hit or miss technique and not a very good one for clinical diagnostics. This is a cytospin preparation of isolated avian mononuclear cells from a bird with Psittacine beak and feather disease. On the left is the negative control preparation using a nonsense probe, and there is no hybrid formation. On the right-hand side is DNA in situ hybridization using a beak and feather disease viral specific probe, and this readily demonstrates the presence of beak and feather disease virus within the mononuclear cell population. This led to the basis of the blood test for the disease. Also, on polymerase chain reaction, the PCR products can be electrophoresed in agarose gel, and the characteristic band can be observed. These are specimens of blood. Notice that the bands indicating the presence of Psittacine beak and feather disease viral nucleic acid fragment are readily observed in mononuclear cell fractions. They are not observed in red blood cells or in granulocytes, which are in the interposed lanes. This is an electron micrograph of a paracrystalline array of Psittacine beak and feather disease virus from a macrophage cytoplasmic inclusion. In this instance, the dark black dots are colloidal gold that are conjugated to an anti-PBFD viral antibody. So it shows that the paracrystalline array is composed of virions of beak and feather disease virus. Although paracrystalline arrays of virus can be observed within the cytoplasm of macrophages, virions are less structurally arranged in affected nuclei. Notice also, again, the colloidal gold label in this nucleus. This is the nucleolus. I have not done extensive electron microscopy on intranuclear inclusions, so in my limited experience, the paracrystalline arrays are not observed. Beak and feather disease can be controlled by DNA probe testing, biosecurity, and reasonable routine hygiene. Any new bird added to an aviary should be quarantined and screened by testing on at least 2 occasions prior to introduction to the aviary. Experimental vaccine trials show that vaccination can be effective in preventing infection, but the problem that is experienced with PBFD virus is that it cannot be propagated indefinitely in cell culture. Therefore, production of killed vaccines will require the expenditure of many birds to replicate enough virus to produce a vaccine. Also, because the vaccine is resistant to most common inactivators, use of a killed vaccine clinically is dangerous and should be avoided. Our experimental research has indicated that production of a recombinant vaccine is feasible, that the vaccine is effective. So hopefully subunit vaccines will be available in the future for prevention and control of Psittacine beak and feather disease. Circovirus infection has also been fairly well documented at this time in pigeons. The original index cases were described in Canada, Australia, and in California in the United States. The earliest that I saw one of these cases was in 1978. The disease also is prevalent now in Europe, and infected birds generally range from 4 weeks old to 1 year of age when they're infected. Problems are particularly severe in 7 to 8 week old squabs. The mortality in given pigeon lofts can range from 1% to 100%. The bursa may be abnormal grossly, but feather lesions generally are rare. To my knowledge, there's only one description of feather dystrophy with circovirus infection in racing pigeons. Secondary infections are diverse and severe and may include viral, bacterial, fungal, and parasitic diseases. Cytoplasmic basophilic inclusions usually are observed in H&E tissue sections of spleen, gut-associated lymphoid tissue, and within bursal macrophages. This is a section of bursa from a pigeon following DNA in situ hybridization. Using a circovirus probe, you can alter the stringency to determine whether the virus is similar or dissimilar to other existing circoviruses. This example shows a Psittacine beak and feather disease virus probe where numerous hybrids are formed with low stringency conditions. By raising the stringency, there is much less intense hybrid formation. What this tells you is that this is a circovirus, but it's not beak and feather disease virus. It's different genomically. And since this early work, we also have disease-specific probes for Pigeon Circovirus. This disease also has been reported in Senegal doves, which will have feather lesions in canaries, in geese, and in one blackback gull. The Senegal doves that have been affected with feather lesions have been reported in Australia. These birds have bilaterally symmetrical feather dystrophy and loss, and the virus appears to be antigenically distinct from beak and feather disease virus. Circovirus infections have also been reported in finches from California, and finches experience feather dystrophy and loss with typical circoviral inclusions. The inclusions are most noticeable as multiple cytoplasmic basophilic inclusions in macrophages of the spleen, bursa, and also within the feather epithelium. Lymphoid depletion and necrosis may be observed. Secondary infections are common. As with most of the other circoviruses, there is no treatment, and the disease can only be prevented by biosecurity. So disease has been described in finches and infrequently in canaries. This is a section of bursa from a finch that is probed using a deoxygenin DNA labeled probe for viral nucleic acid. On the left is a control section, negative control. Next we'll go into the polyomavirus group. The Herpesviridae family contains two genera. One is polyomavirus and the other is papillomavirus. As you know, papillomaviruses cause benign growths or warts in a number of animal species. Polyomavirus infection in mammals also is associated with tumor development, but in birds, avian polyomavirus lacks the large T or transforming antigen, so neoplasms are not observed. Some interesting facts on the history of avian polyomavirus infection. In 1981, losses of budgerigars right at the fledging period were observed in both the United States and Canada. The tissues had amphophilic intranuclear inclusions, and these suggested a viral etiology. With further study, the virus was characterized as a papovavirus, and with more refined studies as a polyomavirus. Since 1981, virus neutralizing antibody testing has been used to diagnose the disease, but the antibody titers do not indicate whether the bird is actively shedding the virus. In 1992, a better diagnostic technique was introduced commercially, and this is molecular testing based on the polymerase chain reaction method. In 1994, a commercial vaccine was also licensed for use in Psittacine birds to protect them against avian polyomavirus infection. And the vaccine is safe and efficacious, and although people have reported rare adverse reactions to vaccination, these usually have involved vaccinating intradermally instead of subcutaneously, and is a proliferative response with macrophages and fibroblasts. These lesions are very uncommon. Only a small fraction of 1% of vaccinates, so extremely low incidence, and the lesions may regress if they are observed. Avian polyomavirus is about 40 to 50 nanometers in diameter. That's the typical viral particle. It has an icosahedral nuclear capsid and is non-enveloped. The DNA genome is circular but double-stranded and is very large, ranging from 4.8 to 5.5 kilobase pairs. This is an electron micrograph of a cell nucleus showing numerous intranuclear polyoma virions. Avian polyomavirus has worldwide distribution, and various strains of virus may be observed. Also, avian polyomavirus infection is observed in captive and free-ranging Psittacine species. Especially notable is the incidence of disease in sulfur-crested cockatoos in the wild in Australia. Avian polyomavirus infection also has been observed in passerine birds, which are the songbirds or finches, and canaries, as well as gallinaceous birds. Viral infection of young birds, these individuals frequently die, while older birds may seroconvert and remain subclinical. Avian polyomavirus has a short incubation period ranging from 2 days to 2 weeks. It is generally transmitted in a horizontal manner among members of a flock where actively infected birds are shedding virus in the feces. Vertical transmission also may occur between generations as the virus is passed from the parent to offspring via egg. Avian polyomavirus infection in budgerigars usually causes the death of nestlings when they are approximately 10 days to 2 weeks of age. Mortality may vary between 25% and 100%. Affected nestlings usually exhibit abdominal distension, multiple subcutaneous hemorrhages, and in addition may have reduced or delayed feathering, and in some individuals an intention tremor or other neurologic signs. There generally is a high incidence of a nestling infection in affected aviaries. Persistent, not latent, but persistent infections may occur. This is a young neonate that had a distended abdomen, abnormal feathering, and subcutaneous hemorrhages. Avian polyomavirus infection in larger or non-Budger-Gar Psittacines can have three forms of the disease: peracute, acute, and chronic. Peracute disease is associated with unexpected death. There are no premonitory clinical signs. Acute disease, the animal usually dies 12 to 48 hours after clinical signs first appear. The clinical signs are generally nonspecific and include depression, anorexia, weight loss, diarrhea, and delayed crop emptying. Because of the diarrhea, the birds also may exhibit polyuria and polydipsia. With severe diarrhea, they may be dehydrated. In addition, affected individuals will show hemorrhages and dyspnea. In chronic polyomavirus infection, weight loss, anorexia, poor feathering, and recurrent infections are the rule. This is an adult cockatoo with persistent chronic polyomavirus infection. Note the abnormal formation of the feathers. The eyes are partially closed. This bird had neurologic disease. This is the brain from that individual showing severe cerebral congestion. Histologic changes in avian polyomavirus infection include the presence of large amphophilic intranuclear inclusions. Although karyomegaly is the rule of thumb, you may occasionally encounter disease in the absence of karyomegaly. The primary tissues to demonstrate inclusions are spleen, liver, and kidney, although inclusion bodies are widespread in many tissues. A characteristic lesion of acute polyomavirus infection is coalescing, multifocal to coalescing hepatocellular necrosis that may be submassive. Viral inclusions may not be apparent in H&E stained tissue sections. Thus, DNA probes or immunohistochemistry are useful in documenting the existence or presence of the virus. This is a histologic section showing typical amphophilic intranuclear inclusions and karyomegaly in the liver. This is an immunohistochemical stained section of liver from a seed cracker with chronic polyomavirus infection. Although inclusions are rare and difficult to discern, the immunohistochemistry readily demonstrates the presence of viral antigen. In this section of spleen, there are intranuclear inclusions. The presence of viral nucleic acid is nicely demonstrated by in situ hybridization. Avian polyomavirus is best diagnosed by a cloacal swab specimen, and this is a DNA probe-based test using the polymerase chain reaction. This disease can also be diagnosed by fluorescent antibody staining of tissue sections or imprints, as well as routine histopathology of paraffin-embedded tissue using DNA probes or immunohistochemistry. The virus also can be isolated in cell culture, although it is more expensive and labor-intensive. Virus-neutralizing antibody titers are unreliable for clinical use and disease diagnosis. In this individual, this is a section of H&E section of feather on the left. Note that there is some debris within macrophages and occasional feather epithelial cells. Cell nuclei are enlarged and appear either clear to slightly basophilic. On the right is an in situ hybridization for Psittacine beak and feather disease, showing a tremendous load of virus within the feather epithelium and extending into the pulp cavity. A closer view of the enlarged nuclei within epithelial cells when this specimen is probed for avian polyomavirus. The presence of viral nucleic acid is demonstrated by the blue-black staining. So DNA probes are valuable in histopathology in demonstrating concurrent viral infections. There is no effective treatment for avian polyomavirus, although immunostimulants and a variety of antiviral drugs have been used. As far as prevention and control of the disease, DNA probe testing will help you identify individuals that are shedding the virus so they can be isolated or removed from the aviary. An inactivated vaccine is currently available and is effective with minimal adverse reactions to the vaccination procedure. It's always important to maintain good biosecurity to prevent avian polyomavirus introduction into the aviary. The virus is relatively environmentally stable and could be introduced on clothing and so forth, so good hygiene is a must. This is a photomicrograph of one of the rare adverse reactions to polyomavirus administration. The vaccine in this instance was given intradermally instead of subcutaneously, and I think you can appreciate the numbers of epithelioid macrophages, fibroblasts, multinucleated giant cells, and the major herpes virus infection of Psittacine birds is called Pacheco's disease. This syndrome or this disease was first described in 1929 by Pacheco and Beer in diseased birds from a zoological park in Brazil. Not until 1975 was the etiologic agent classified as a herpes virus and reported in the United States. By the 1980s, commercial vaccines had been produced to protect birds against Pacheco's disease virus. Herpes viruses are approximately 120 to 200 nanometer diameter virions. They are an envelope virus, and the lipoprotein envelope is derived as the virus buds from the cell membrane. These viruses replicate within the nucleus and will cause intranuclear inclusion bodies. The DNA is approximately 121 to 227 kilobase pairs. It is double-stranded and in a linear configuration. Most of these Psittacine herpes virus isolates are alpha Herpesviridae subfamily. A characteristic of herpes virus infection is that the birds may develop lifelong latent infections with periodic recurrence of viral shedding. An example to remember this by would be herpetic cold sores in people. This is a diagram of a schematic of herpes virus. Notice that the viral capsid is surrounded by a lipoprotein envelope. The capsid contains the DNA genome. This is an electron micrograph of intranuclear herpes virus particles. And notice that these have the outer capsid and a central core. The membrane, of course, is not apparent here because the viruses have not yet budded from the nuclear or cell membrane. Herpes viruses can be a very large problem in aviaries because animals may have latent infections. The new birds that are added to the aviary may be the source or focal point of a new infection, new viral infection, but physically they can look totally normal when they are examined prior to being admitted to the aviary. So periodic recurrence of viral shedding will spark new epernetics among naive individuals. With outbreaks of Pacheco's disease, there usually is a characteristic medical history. Most often, new birds have been purchased and added to an existing stable aviary. Occasionally, there is a history of exposure to other birds, either at sexing clinics or at bird fairs or shows or other gatherings of Psittacine species. Pacheco's disease in the aviary usually presents as sudden deaths in otherwise healthy birds within a flock, and the deaths may involve a single pair of birds or a massive mortality. Often the history is that birds have just been found dead in the enclosure with no premonitory signs. Pacheco's disease enjoys worldwide distribution, and as I have mentioned previously, infected birds may either be asymptomatic or demonstrate clinical signs. Latent infections are common. Old World Psittacines appear to be more resistant to the disease than the New World Psittacine birds. And with Pacheco's disease, 3 different serotypes of virus have been described. This viral infection is usually transmitted by direct contact. Tremendous numbers of virions are excreted in the feces of infected birds, and these are the sources of infection for other susceptible or naive birds. Virus-contaminated fecal material also may be pulverized and aerosolized and serve as a source of infection in that manner. The signs of disease are variable. Occasionally, just sudden death or the bird is found dead in the enclosure with few premonitory signs. In other individuals, depression and anorexia may be combined with the discharge of yellow-green urates, or the bird may experience hemorrhagic diarrhea. Some birds will also regurgitate mucus that is red, indicating the presence of blood. These birds with regurgitation and diarrhea also exhibit marked polydipsia and polyuria. In some individuals with Pacheco's disease, CNS signs such as tremors, seizures, and ophthalmos may be observed. However, it is uncertain whether these neurologic signs are due to primary brain involvement in the pathogenesis of viral disease or the result of some biochemical lesions such as hypoglycemia related to hepatocyte destruction. The incubation period for Pacheco's disease is very short, usually 3 to 4 days after experimental inoculation to up to 2 weeks after new birds are added to the aviary. Death of infected individuals can occur anywhere from a few hours to a couple of days after the first clinical signs of disease appear. During the course of the disease, tremendous numbers of virions can be shed in the feces. As far as pathologic changes, the characteristic change of Pacheco's disease is marked hepatomegaly coupled with multifocal necrosis and hemorrhage. In addition, segmental or more diffuse intestinal hemorrhage, splenomegaly with hemorrhage, renal hemorrhage also may be observed. Inclusion bodies in histologic sections have been classically described as intranuclear and eosinophilic, the so-called Cowdrey type A inclusions. In my experience in herpesvirus infections of Psittacine birds, the inclusions will sometimes have a more basophilic cast. This is a section of liver from a parrot with Pacheco's disease. Notice the hepatocellular necrosis and the presence of eosinophilic to, in some instances, slightly basophilic intranuclear inclusions. As far as the immune system in Pacheco's disease goes, the presence of antibodies indicate viral exposure. They do not necessarily indicate whether the bird has latent infection or is actively infected. However, the virus can cause persistent infections that are latent and may reappear from time to time. Increased antibody production in the serum can usually be demonstrated when viral shedding is occurring. Hens can pass protective immunity to the chicks via egg yolk antibodies, and once the chicks receive this passive transfer, they may remain clinically normal or may occasionally develop latent infections. Diagnosis of Pacheco's disease is most often performed via histopathology with the appearance of the eosinophilic intranuclear inclusion bodies. To demonstrate that Pacheco's virus, a specific herpes virus, is definitely involved requires the use of DNA probes or immunohistochemistry. The primary tissues to diagnose Pacheco's disease would include liver and spleen, also kidney. Brain and lung are used primarily to exclude other possible viral diseases other than Pacheco's disease. Electron microscopy can demonstrate herpes virus, however, it is expensive and may be time-consuming. Likewise, classical virus isolation can be labor-intensive, expensive, and time-consuming. Serology for antibody titers is useful only with paired sera, with acute and convalescent sera, to determine whether viral infection was present and whether it was progressive or regressing. This is another histologic section of liver with multifocal necrosis of hepatocytes and scattered intranuclear eosinophilic inclusion bodies. This is a similar or replicate tissue section following DNA probing for Pacheco's disease herpes virus. The blue-black staining indicates the presence of viral nucleic acid within infected cell nuclei. This is an instance of forensic pathology where a parrot died. It was one of several in the household. A new bird had been introduced. These were owned by a private individual and were revered pets. When this parrot died, the owner buried it out in the backyard in the hot July sun, where it remained for 3 days. Then the owner thought maybe it would be a good idea to get a definitive diagnosis in case the other birds were going to get this same disease, and maybe it could be treated and prevented. So the bird was disinterred, sent to the local veterinarian, who had to be out of town for a day or so, and froze the body. Following thawing, the post was done and the tissues were referred for testing to the University of Georgia College of Veterinary Medicine. On the left-hand side, I think you can appreciate the necrosis and inability to see discrete viral nuclear inclusions. On replicate sections on the right-hand side following DNA probing, the presence of herpes virus is readily identified in hepatocytes and biliary epithelium. The remaining pet birds in the household were placed on a preventive treatment of acyclovir, and there were no further outbreaks. As far as treatment of birds with Pacheco's disease, supportive care is mandatory. Acyclovir can be administered at 80 milligrams per kilogram given by crop gavage every 8 hours. Treatment should be continued for 7 to 10 days, and this will decrease viral shedding by impairing viral replication. As far as prevention and control, good hygiene, disinfection may be of some benefit here because if the lipoprotein envelope is damaged, the virus will not be infective. Biosecurity to prevent introduction of the herpes virus into the aviary. Part of the program of biosecurity should be the isolation of all new birds. A vaccine is available for subcutaneous administration, and it is effective. There's an atypical manifestation of herpes virus infection in Psittacine birds that is referred to as Psittacine tracheitis virus. This infection is similar to infectious laryngotracheitis in chickens, which is also caused by herpes virus. In my experience, Psittacine tracheitis virus outbreaks are infrequently observed compared to classical Pacheco's disease. These viral infections may have peracute, acute, or chronic respiratory disease, and the most frequent clinical signs are open mouth breathing and change in vocalization. The change in vocalization can be quite dramatic because in larger Psittacines they have intense squawks that can be ear-shattering, but in the Psittacine tracheitis virus infection they are hoarse, and you really don't need your sonic ear protectors as frequently. Signs of disease that can be observed grossly include tracheal hemorrhage and diphtheritic membranes. As far as microscopic changes, there will be extravasated erythrocytes in the lumen of the trachea. Diphtheritic membranes may be observed. Interestingly, this viral infection causes the formation of large syncytial cells, particularly in the lower airways and air sacs, and these syncytial cells have intranuclear eosinophilic inclusions. Air sacculitis is also part of the pathology of this disease. Diagnosis of Psittacine tracheitis virus can be done ante-mortem via virus isolation from swabs or from mucus specimens. Post-mortem diagnosis usually is accomplished by histopathology. These are H&E stained tissue sections of lung parenchyma showing the presence of eosinophilic intranuclear inclusions, and this is a syncytial cell. Multinucleate cell, each individual nucleus has an eosinophilic inclusion. As far as prevention of Psittacine tracheitis virus, vaccination has been proposed, and anecdotal reports suggest that there is cross protection from using poultry infectious laryngotracheitis vaccines, but these anecdotal reports have not been confirmed experimentally. Avian adenovirus infections. Adenoviruses are 70 to 90 nanometer diameter virions. They have geometric symmetry to the capsid, and one unusual feature of adenoviruses is that they have pentamer fibers that extend and have a terminal knob on them. Usually these fibers are dual in avian adenoviruses. Adenoviruses are non-enveloped and can contain a 30 to 37 kilobase pair double-stranded DNA in a linear configuration. Now this schematic shows the pentamer fibers that are projecting from the capsule, and the usually are dual fibers are present in avian adenoviruses, and the terminal knob structure will give the virus some of its agglutinating features. Psittacine adenoviruses have worldwide distribution. Although any age bird can be infected with adenovirus, usually younger birds with disease are observed more frequently. The incubation period is very short, being only 1 to 2 days in duration. Spread of the virus occurs slowly by contact or contact with viral contaminated fomites. Vertical transmission, however, also is possible. Transmission of the virus involves fecal contamination, so contact with feces with infective virus or feces contaminated objects are involved in transmission of the disease. The adenovirus genus is part of the Adenoviridae family. Adenoviridae have two distinct groups. The mammalian adenovirus is referred to as mast adenovirus, and the avian adenovirus genus, which is called Aviadenovirus. Within the avian adenoviruses, most of these are type 1 viruses, infrequently type 2 viruses. The type 2 viruses are usually involved with inclusion body splenitis. Of the type 1 aviadenoviruses, there are at least 12 different serotypes in chickens. There have been several isolates from budgerigars and other unclassified isolates from Psittacine birds. In poultry, avian adenovirus is widespread. It's found throughout the world, and there has been some degree of controversy on ability to produce disease in birds. Morbidity and mortality are variable. They can be extremely low or extremely high, depending both on the host that is infected and on the strain of virus with which the bird is infected. So, aviadenovirus infection in poultry can range from asymptomatic infections where the birds harbor the virus with no ill effects to the virus being a primary pathogen resulting in death of the bird. As I've mentioned, avian adenovirus infection can be asymptomatic to causing overt disease. And the types of disease that are seen in poultry include tracheobronchitis, splenitis, hepatitis, pancreatitis, enteritis, including typhlitis and egg drop syndrome. Tracheobronchitis is very prevalent in quail. Splenitis and hepatitis and egg drop syndrome are observed most oftenly in chickens. And for those of you that are unfamiliar with avian diseases, egg drop syndrome is not just inapparent dropping or loss of eggs from an individual hen, but an overall drop in egg productivity. As I've mentioned, adenovirus infections can be spread both horizontally and vertically. This is a deformed eggshell. Note the ruffles and ridges from a hen with avian adenovirus infection, and this bird was involved in an egg drop syndrome type outbreak. In Psittacine adenovirus, various nonspecific clinical signs may be apparent, including anorexia, depression, diarrhea, and loose droppings. In addition, conjunctivitis and cloacal hemorrhage have been observed prior to death. Disease syndromes that can be seen in adenovirus infection of Psittacine birds include hepatitis, enteritis, pancreatitis, renal disease, as well as conjunctivitis. Most adenovirus infections in Psittacine birds are associated with the formation of basophilic intranuclear inclusions. In many instances, cell nuclei are not enlarged or discernibly enlarged. In other individuals, there will be extremely large basophilic intranuclear inclusions. Most often, adenovirus infection in Psittacine birds is associated with intestinal and hepatic necrosis. And for this reason, if you suspect avian adenovirus infection, two of the best tissues to have on hand to examine are liver and intestine. This is an electron micrograph of a nucleus containing paracrystalline arrays of adenovirus. This happens to be from an adenovirus outbreak in pigeons. This closer view shows that the adenoviruses may be arranged in paracrystalline arrays, but they also may present as aggregates that really lack a true paracrystalline arrangement. Touch imprints of liver from an infected Psittacine bird. Intranuclear inclusions may be seen in hepatocytes. This is a large intranuclear inclusion, and on hematoxylin and eosin stained tissue sections would be a large basophilic intranuclear inclusion. And you can appreciate the tremendous size of this intranuclear inclusion when compared to more normal hepatocyte nuclei. This is a section of necrotic liver from a Psittacine with adenovirus infections. Notice the basophilic intranuclear inclusions. DNA in situ hybridization will readily demonstrate the presence of adenoviral nucleic acid within an infected cell nuclei. This is another section of liver from a Psittacine bird, and this represents the beginnings of enlarged basophilic intranuclear inclusions, and they can be tremendous in size. And DNA in situ hybridization, again showing the presence of viral nucleic acid. Disease diagnosis can also be done by polymerase chain reaction methods, employing virus-specific primers to generate predicted fragments of the nucleic acid. Prevention and control of Psittacine adenovirus, a major consideration here is biosecurity. Contact should be minimized between the Psittacine birds and any free-ranging populations of pigeons or waterfowl. As in all biosecurity measures, newly introduced birds should be isolated in quarantine prior to entry into the aviary. In disease outbreaks, control of the disease involves the removal of contaminated litter, food, water, feeding containers, and fecal material. Adenovirus is generally environmentally stable, and disinfection can be very difficult. As a matter of fact, Clorox is probably the most effective or economical disinfectant for use in the aviary. And there also are some other chlorine dioxides that can be used as well. There is no specific therapy or vaccine available to prevent avian adenovirus infection in Psittacine birds. The last virus that I'll cover is parrot papillomavirus. Papillomaviruses are non-enveloped and have an icosahedral geometric symmetry to the capsid. The genome is double-stranded and circular and is fairly large at 6.7 to 8.2 kilobase pairs. Now, papillomavirus, is one of the other major divisions of the Circoviridae family. And papillomavirus infections in birds have been associated with tumorous growths or warts on the legs and around the commissure of the beak of chaffinches and bramblings. Also, lesions have been observed at the commissure of the beak and on the head of canaries. To see papillomas in Psittacine birds, particularly involving the commissure of the beak or face or feet, is fairly unusual. But they have been described in the African gray parrot, and besides being found on the commissure of the beak and the head, they can also be found on the eyelids or palpebra. Most of the papillomas in Psittacine birds are cloacal papillomas of unknown etiology. This is a cloacal papilloma from an African gray parrot, and notice that the surface of the papilloma is covered by a stratified squamous epithelium that exhibits ballooning degeneration. Also, rare basophilic intranuclear inclusions were observed, suggesting papillomavirus infection. On the left is a DNA in situ PCR technique that is specific for parrot papillomavirus, the only papillomavirus that has been investigated in any detail in Psittacine birds. And this last slide will demonstrate parrot papillomavirus in a cloacal papilloma. Routine DNA in situ hybridization will produce faint chromogen deposition indicating some hybrid formation. But to intensify the reaction, you can also do DNA in situ polymerase chain reaction, where you glue a chamber to the surface of the paraffin-embedded tissue section, add your nucleotides, your Taq polymerase, and your primers, and then go through the heating cooling cycles to amplify product that subsequently is detected by affinity cytochemistry and DNA probing. Generally, at this point in time, the etiology of papillomas, cloacal papillomas in Psittacine birds has been undetermined. Of the numbers that I have checked for the presence of polyomavirus, herpesvirus, and papillomavirus, I've only successfully demonstrated papillomavirus in one instance, and that was in a cloacal papilloma from an African gray parrot. So the pathogenesis of cloacal papillomas in Psittacine birds is still obscure, but an interesting fact is that these papillomas also have a high incidence with bile duct hyperplasia and bile duct carcinoma in these birds. This concludes my lecture on selected viral diseases of Psittacine birds.